Castellano here at Image Lift. We're here today with Tracy. Tracy, you feel that relaxing medicine settling in? We are going to be doing the eyelids, upper eyes for Tracy. Here are her before pictures. We just did some of the filler, and you can see that upper eyelid skin that we're going to trim that. We use the one stitch technique. So we got everything set up, and you can see our instruments right over there. And Yesenia has everything set up perfectly, and Pam is our camera person, our award-winning camera person. So when I do the eyelid treatment, I'm going to measure out, I'm going to draw out the upper eyelid. And you can measure the amount of skin that you remove when you pinch. And you can see if you take too much, it's going to make it difficult for the eyelid to close. Obviously, we won't let that happen. That's why, as we say, we measure twice and cut once. So Yesenia, I'm going to have you scoot that tray over a little bit so I can stand at the head. I'm going to raise this up just a little bit. So I'm going to have you scoot it over this way. There we go. Now we're drawing with the marker. On that upper eyelid crease for the physicians and students that are watching, this incision will fade and hide very nicely into the upper eyelid crease. And we got a camera changeover. Just make sure you get as close as you can. And you may, does Pam need to head out? She was doing fine. Is Pam leaving? I mean, Pam can do it if you're leaving, Charlene. We have so many camera people in here. We have an abundance of camera people. And Tracy feels that relaxing medicine. So smooth forceps. I feel pretty relaxed too.
My eyes are already numb.
So I'm going to do, you'll feel it's just a tiny, tiny pinch for the numbing for the eyes. So they're not numb yet. And see how when I pinch the skin, I'm taking that extra. Her eye still stays closed. She has beautiful long eyelashes. And if you're just now joining, you've got to see Tracy's boots. Tracy has the best boots. You got to show them her boots. Look at that. It's Stop and Smell the Roses Day. You see these boots? I mean, are you kidding me? And I wore my Stop and Smell the Roses suit, and she wore her Stop and Smell the Roses boots. So we are a team here. And Yesenia and Charlene and Pam have everything set up perfectly for me. Makes it very easy. Perfect. So you can see I'm taking a comfortable amount of skin here. And we're going to leave the muscle, we'll leave the fat. So at this point, you feel a tiny little pinch here. So you feel pinch on 3, 1, 2, 3, pinch. You feel small, medium, big pinch. Tell me what you feel there. Small, medium, bigger. How about now? Do you feel that starting to ease up? You feel some pressure there.
Yeah.
So when you're numbing, for the physicians and students that are watching, if you just go really, really slow, it's hard for them to feel the numbing. They might feel a tiny pinch. How about here? Do you feel a little pressure, a little pinch?
Not really.
Not really? Okay. So, but you can see how I'm very gradually, let me show you here.
Oh, yeah, it's numb.
Yeah, it's pretty numb. But I want you to, Charlene, see, get it right here. See how slowly I'm advancing that? Zoom in and see if you can get that. I'm just doing like 1/10 of a cc. You see that tiny little bit? We're just doing the smallest amount, and it's starting to balloon a little bit. So now, how about here? Do you feel pinch? So it's a really small amount. I'm not in a hurry. We got time. My team will tell you, oh, he's in a hurry. Well, I mean, I want to get things done fast, but here we take our time. They're like, oh my gosh, did Dr. Rich say he wasn't in a hurry? He's so funny. They're laughing at that. They're not supposed to laugh that hard. I mean, we got patients to see. We can't sit around. But when I'm here and we're taking care of patients, I'm definitely not in a hurry. Always fast, but never hurry. Tracy, do you feel a pinch there?
A little. It kind of burns my eyes.
She'll feel a little burning, but you see we're on the outside. So I promise we're not in the eye, okay? We're going slowly. And when you do it like this, it's just much more comfortable for the patient. How about here? Small, medium, big pinch? Not too bad? And you see it's puffy like that. That's all the numbing medicine. And that's about 3 cc's of lidocaine. And we'll do the same on the other side. Because we're doing both sides today, right? Just kidding with you. Of course we're doing both sides. I'm just kidding. We always do both sides. How about here? Pressure pinch? A little bit. She feels a little pinch there. So let's take a break now. Now that's going to feel so numb for her.
It's numb from my eyeball to be burning.
Yeah, the eye, you might feel a little burning sensation, but we are very superficial.
Okay.
And it's goofy to open the eyes when it's swollen like that. How about here? How many fingers here?
2.
See, so she can see just fine, but it's goofy when it's swollen like that. Are you feeling any pain over here or not really? Okay, so no pain. It's nice and numb. She doesn't feel it when I'm here. She doesn't feel that, right? So now you do feel a little pinch over here on this side. 1, 2, 3. Pinch, sorry, little pinch. So she feels the pinch and she's going to feel that start to fade and settle. You feel that starting to ease up just a little bit. We'll go slowly. Big deep breath in and out. How about now? Do you feel pressure, pinch, a little bit of both? So we'll go slowly. And I'm literally injecting about 1/10 of a cc every 3 or 5 seconds. So that means it's going to take me almost a minute to inject a full cc of lidocaine. And that's okay. We've got time. We're here. Might as well do it the right way. We want to make sure Tracy's happy. You feel a little bit of a pinch here? You're going to love your results. Everything's looking good. So, very slow injection technique with the lidocaine. The lidocaine takes effect very quickly. This is lidocaine with epinephrine. The epinephrine prevents the lidocaine from dispersing. It also reduces bleeding. You feel a little bit of a pinch there? Everything's looking good. Thank you for watching. Thank you for sharing. We're on a mission to stop bad plastic surgery. We'll show you how to do it the right way. It is not necessary to have IV sedation for eyelids or general anesthesia. Little tiny pressure, little tiny pinch. Everything's looking good. If they have questions or comments, Charlie, just let me know.
You got it.
Feel a little tiny pinch there. Okay, can I have another local, please? So now, at this point, now that we've done that, and when I put, do you feel any pinching here or not really? So now I'm just adding a little bit, but she doesn't feel it. You feel pinch there?
No, just like pressure in my eyes.
You might feel like a little pressure. Everything's looking so good. You're going to love it. And we're far away from the eyes. We're staying super superficial.
It just feels funny.
It feels goofy, but it looks really good. So then, if you feel any pinching, you let me know. You'll feel a little pressure. Everything is looking good. Perfect. Thank goodness for lidocaine.
Yes.
I can't imagine when dentists and doctors had to work before lidocaine was readily available.
And they used to give out liquor.
Yeah, that's right, liquor. Jack Daniels. Tracy, how you feeling, dear? Are you feeling any pain at all? Me neither. So now this is just superficial to the muscle, which is called the orbicularis oculi. That's the muscle that closes the eye. It's a purse string-like muscle. And I'm just spreading for the physicians and students that are watching. This is a relatively avascular plane. There's a few tiny little blood vessels there. Very good. We're in Tampa and the Villages, Florida. I am a double board certified facial, plastic, and reconstructive surgeon. I've done over 4,000 facelifts under local anesthesia and over 20,000 syringes of filler. You get the hang of it after a few thousand. Most of the injectors in the industry really are beginners or intermediate level. So you want an advanced level injector. And if you're doing eyelids, of course, you certainly want someone who's done a lot of them. And the muscle sparing technique, I call it my one stitch technique. This is a bipolar cautery. Are you feeling any discomfort at all, Tracy? Very good. And as you can see, there's very little significant bleeding. It looks really, really good. Bipolar does a great job, and I'm going to use the one stitch all the way across at 5-0 Proline. And then my team surprised me the other day. They got some 4-0 Proline. I was like, 4-0? Who's the 4-0 for? What's going on? You guys are so funny. Always playing games. You got a great team. Well, Christine got 4-0. We went to 5-0.
Always.
Same way every time. That's our motto. Same way every time when it comes to prep. And when I'm doing the procedure, let me turn your head this way just a little bit. In the treatment, I'm going to use numbing. I will adjust things for sure. But the preparation, I want all my same instruments. I want all the same equipment ready so we can do a great job. Now, when the eyelid is swollen like this, it feels difficult to close the eye. So here is the 5-0 Proline. 5-0 Proline, can you see that on there?
Yes.
Okay, very, very tiny little, it's like almost the thickness of a human hair. Tracy, how are you feeling? Everything's looking good. Running subcuticular or a running intradermal. I'm going back and forth into the dermis of the skin. And this is a great stitch because it does not leave any suture marks on the outside. So that's a big advantage. When I was doing my training, we would put tiny little stitches all the way across, little knots all the way, and it's just not necessary. This is a far superior way to do things. Very good. And when the patient comes back, they appreciate that you don't have to take out a bunch of stitches. Perfect. No. So as you can see, the suture goes back and forth and brings it together so nicely. I like to fuss over the little details because we're here. Why not?
Can you do liposuction for the chin?
Yes, we can do liposuction, we can do platysmoplasty, we can do laser lipolysis, all of the above. Thank you for watching. Thank you for sharing. You will help a family member or friend stay out of trouble by sharing this and they see how to do things the right way. You don't need to remove fat. You don't need to remove muscle. Everything's looking good. A little knot here. And we always point those scissors away from the eye. That's good right there. Tighten a little knot down.
Is it expensive to get this done?
It's expensive to have it done incorrectly the first time around. So it's much more cost effective to have it done the right way first time around. I'm adding just a tiny, tiny little stitch here. Yeah, when it comes to your face, you want to have things done the right way. And you don't want to save money. You don't want the cheapest eyelid procedure in town. Do not recommend that. Very good. Perfect. So just a tiny little extra stitch right here. And again, it does not leave any suture line, so that's the big advantage of this suture technique. Thank you for watching. Thank you for sharing. Okay, I'm coming over there. I'll give this to you. Tracy, how you feeling? You can stay there, Charlie.
Okay.
Wherever you, yeah. If you're just now joining, you want to show them the, oh, that's fine.
So what?
The pictures, yeah. You can grab the computer and then show them. Here we go. Let's take a look. Here's her before pictures. We're trimming that eyelid skin. Now, of course, as we say, you don't want to taste the chocolate cake before it's done baking. You can just set that on the tray. Okay. Let me turn your head this way just a little bit. So she's swollen across through here. The eyelid will feel like it closes a little differently because of the swelling. And then you put some ice on there. It goes down relatively quickly. The eyelid skin is the thinnest skin in the entire body. So anytime you have swelling, it shows up a little more easily there. So now that you've done the numbing, Tracy, are you feeling any discomfort at all, dear?
Mm-mm.
Everything's looking good. So measure twice, cut once, and looking really good. And Tracy has her awesome boots on. Do you have other cool pair of boots, or are these like D1 cool pair? You got others? Oh man, I want to see some of this boot selection. Penotomies and traction, counter traction. No. So I'm just doing traction, counter traction with my traction here and then counter traction with the tips of my instruments. You'll feel, sometimes when the numbing medicine seeps out, you might feel a little bit of burning, and that's normal, and that'll go away. You feel like a tiny bit of burning there?
Yeah, in my eyeball.
That's just the numbing medicine, and that totally goes away, okay?
Mm-hmm.
Everything's looking good. Perfect. So bipolar cautery just to seal the blood vessels. Thank you for watching. Thank you for sharing. You've got family members or friends that are interested in doing a treatment. Let them know. We're here to help you raise your standards and do things the right way. The ABCs of plastic surgery. If you know the ABCs, you will make better decisions and you will understand the bigger picture. A stands for area. There's 4 areas. Tracy, how you feeling, dear?
Okay.
You feeling any pain at all?
Nope.
A stands for 4 areas. Number 1, if we sag, we're going to tighten. I'm going to turn your head this way a little bit. Number 2, if we lose volume, we're going to fill. Number 3, sun damage, wrinkles, and sunspots to the skin. We polish and repair the skin. The 4th area is better than everything else. That's our behavior. And Tracy definitely knows the power of smile. She's a great smiler. And none of our treatments look as good as Mother Nature's free face love. 5-O-Proline.
How long does this procedure take?
It takes me about 30 minutes to do the upper eyes. Or less. Especially when my team has everything set up so well for me. So A is for area, tightening, volume, skin, behavior. B is for boundaries. There's 4 rules for good plastic surgery. Safety is always first. You must look natural. Let's prevent future aging changes. And let's get as much improvement as possible. We can't make things perfect. We're not God. We do the best we can. If we need to come back another day and do more, that's better than going too far. A for area, B for boundary, C stands for combination. If we want our best results, we combine. Like today, what we did was combination because we did both filler and tightening of the eyelid skin. Removal of the eyelid skin. If you want your best results, but you only want one treatment, we do tightening or the skin removal. And if you want your best result with just no downtime at all, then we're talking about fillers. Now fillers do a great job, but they don't give us a lift. And lifting, I get wonderful results, but I can do even better when I combine. So if you understand these different categories of treatment, you will see that whatever results you get, if you're happy with your result, great. If you need more result than what you've achieved, you can either do more of that treatment or take the next step up. Everything's looking good. Perfect. Thank you for watching. Thank you for sharing. We're wrapping things up. Happy New Year. We made it to 2021. It's hard to believe, right? 2021. We're down to 2020. That's a good thing. So now, we slide the stitch across. Turn this one quickly. Don't aim towards the eye. Okay, Tracy, we are completely done. Hopefully that wasn't too bad. You did great. Your eyes are going to feel swollen and difficult to open. Why don't you try to open your eyes just a little bit? How many fingers here?
2.
How about over here?
3.
Okay, can you show the pictures one more time
Yes.
before we show me?
Mm-hmm.
You got your pictures right here. Here we go. So see the before pictures. Tracy did great. We did a little bit of filler. We did a little bit of, so let me show them. We did filler around the mouth. We trimmed the eyelid skin. Thank you all for watching. We'll see you in the next video. We're on a mission to stop bad plastic surgery. We're here to raise your standards and make sure that you look your best. Because many people, they're living a lot longer and you want to look better I'm Dr. Rich Castellano. We'll see you in the next video. See you later. Congratulations, Tracy. You did great. Thank you, everybody. Great job.